Welcome, everyone, and thank you for joining the session today. We're going to be speaking about mastering interview preparation, the research, the readiness, and confidence, so that the next time you walk into an interview, you walk in there fully prepared with the highest chance of success. My name's Lisa Lucas, and I'm the founder and CEO of the HIve Nursing Development, and I'm partnered with Marin Wynn, who's co-founder and mentor in the HIve Nursing Development. We created the HIve Nursing Development because we could see a gap in the nursing education that we're offered and provided. We're both nursing directors and have worked in the executive level for many years now, and we could see that we need to be able to fill that gap with mentorship, leadership training, recruitment training, and everything that comes with career development for nurses and midwives. So we're very passionate about helping others and really building the workforce that we love so dearly. Let's dive into today's topic. The objective of today is to equip you with a structured approach to interview preparation and ensure that you can enter confidently, prepared, and ready for success. The learning outcomes of today's presentation is to gain an understanding of essential pre-interview research strategies, review best practices for organizing those interview notes and responses, and explore some of your personal strengths and how to articulate them effectively. We also want to recognize some key interview etiquette and some body language tips. Let's start with the foundation, which is research. Interview preparation isn't just about impressing the panel. It's also about making sure that it's the right organization and role for you. Researching the organisation allows you to ask informed questions and gauge whether their culture, leadership, and mission aligns with your own values and goals. Every hospital and health service will have its own values, mission, and vision, and these will generally be included in all or some of the interview questions as well. Today, more than ever, recruitment is focusing on cultural fit, not just the technical skills. The thought is that skills can be taught, but if you recruit the wrong type of person, then you end up with a management problem and potentially a cultural problem. So it's crucial to understand what the organisation stands for, and it's also crucial to ask yourself, do their values align with mine? Another key piece is to understand what the service and the hospital offers. So if you're aiming for a high acuity care, but the hospital diverts those cases, you may end up in a role that doesn't satisfy your clinical interests. So you need to be researching things like the clinical service capability framework of the facility that you're looking to move to. It tells you what services are available and what levels in both public and private hospitals of what patient care and acuity is cared for in that facility. Now let's shift to researching the position itself. Having an in-depth understanding of the position will improve the likelihood of having a successful interview outcome. You're looking to get an idea of what the day-to-day activities will be. It will give you the ability to prepare appropriate questions, to ask the interview for clarification or details about the role. This helps to show you understand the role and that you're the right person for the role. So researching the role before an interview will also help you decide whether the position is actually right for you. There's a number of ways you can do this, and I've put some tips up there on the screen. But one of the most easy and achievable ways to do this is by meeting with others that fulfill a similar role or are in the role you're looking to move to. It's important to understand that certain roles can have very different focus depending on where you're applying for the position. For an example, a clinical nurse consultant in Queensland can have a very different day-to-day expectations depending on the health service. Some may focus on patient flow, some may focus on expert clinical care, and some may be very policy and procedure focused. By meeting with someone that in the position at the health service you are looking to apply for would be highly beneficial. However, this isn't always achievable or available to you. So if the position is vacant and there is only one person of the position available, then obviously you can't do this. Another way of researching the position is to complete a shadow day with someone within the role so that you can get an idea of what the day-to-day activities look like and ask questions. Again, this is only achievable if there is actually someone sitting in the role or you have direct access to someone sitting in a similar role. The easiest way for anyone that's going to apply for a position to get some understanding of the role is to actually contact the panel chair and ask questions. And a lot of people feel that they can't do this. It's actually something that we recommend you do before you submit your application, is to contact the panel chair, and you absolutely can and should do this. You want to ask some key questions of the panel chair, and this will not only direct the written application, but it will also direct what kind of questions they're going to ask you based on the type of person that they're looking for. So some of the questions you'll ask is what kind of day-to-day tasks are expected, although this will also be on the role description. And also, is there anything that is a key focus for the role? But ultimately, my favorite question to ask any panel chair is, what type of person are you looking for? This will really direct your research and your preparation for interview and application. The next thing you want to research is the workplace culture. When you're preparing for an interview, don't overlook this. It is a really important aspect to make sure that you've considered. It can significantly impact your day-to-day and your satisfaction in the role. So start by exploring the company's website, their LinkedIn and social media. These platforms often reflect their tone, their values, and current initiatives that are occurring within the health service or hospital. You need to dig deeper as well, and you should be able to access their strategic plans, their organizational profiles, and even using unions and their service profiles, such as the QNMU. These documents can give you insights into long-term goals and priorities for the HHS. Most importantly, you need to ask yourself a very valuable question. Do their values align with mine? Finding that alignment helps ensure that the role isn't just a good job, but it is the right fit for you. Now that you've got some information on the position, the role, and the culture of the facility, you need to actually identify your strengths. And this is a really important component of preparing for interview. You need to ask yourself, what do you bring to the table? What is your unique blend of skills, experience, and attributes that sets you apart from everyone else? You need to write down these things, and you need to really, really own them. Then for each one, you need to connect it to a time and place when you've demonstrated that skill or trait. By doing this, you can really own each of the traits and skills and attributes because you've connected them to a time and place when you have actually demonstrated them. It will help you build that strong sense of self and confidence as you prepare for the interview. Here's a little activity that you can do with just that. Now, the reason we've picked write down 50 things you bring to the table is because often people feel like that is a really big number and you can't get to 50. You absolutely should and can push past and get to 50 things. This is all about building your confidence, your self-worth, so that when you walk into the interview, you absolutely walk in there with confidence. You also need to ensure that you're ready to ask some questions of the panel when you get there. And you should always prepare these questions prior to going in for interview. They need to be insightful, and they need to show that you have an understanding of the role. This is a key thing that many people will skip over. And generally, by the time they get to the end of the interview, they just want to leave. This is your opportunity to get some understanding from the panel about what the key challenges are for the role, and ask them to describe some of the team dynamics that you can expect. It also gives you an opportunity to show the panel that you understand the position, which is a really important component. And remember, how you leave the interview is really important because it's the last impression that you leave. So always ask questions. Now let's have a look at how you prepare all your notes. So let's do an activity. What are at least 3 questions that you might ask at the end of an interview that show you have an understanding of the role? Write them down and keep them somewhere safe, because the next time you're applying for a position, you can pull these out as go-to questions. These will change depending on the position that you're applying for, but it's good to have some up your sleeve. Now let's have a look at how we prepare all these notes and questions so that we're ready to go. Let's be real, interviews are quite stressful, and nerves can often sabotage even the most qualified candidate. Ensuring that you're prepared and organized is really important. Here's an example of an interview preparation template that we use at the HIve Nursing Development. It gives you an opportunity to put down what you understand or have researched about the position, the health service, the hospital, and the culture. It gives a position to put your questions that you want to ask the panel, and then a little section where you can put your 50 things that you bring to the table. These are great for in your preparation for the interview, before you go in, you can just recover it just to give yourself a little bit more confidence and boost before you go in. Now, remember, if you've got War and Peace and 50 pages to flick through as your interview notes, that will make you feel very stressed and anxious to find the right information in a short period of time. So just make sure that you keep your notes concise so that you can review them quickly before the interview. So let's look at some key skills for a successful interview. Often this will be your first meeting with the recruiter or the hiring panel. If you appear unprepared, it immediately sends the message that you're not serious about the job. Preparation equals enthusiasm. So think about what questions you're likely to be asked and go back to your research. What kind of candidate are they looking for? If culture is a known issue, expect there'll be a question on it. If it's a really clinical expert role, then expect a technical or scenario-based question. It's important to be prepared for this. Other key skills are the tangible things. So firstly, this may seem obvious, but be honest. Don't lie in an interview. It will only come back to bite you, and you generally get caught out. Common lies that we see in interviews are that people claim others' work as their own. You don't know who will be on the interview panel, and you don't want to get caught red-faced if you've not been honest. Interview panels have a broad industry knowledge and connection, and integrity builds trust and credibility. So remember this if you're thinking about embellishing on your own experience. Just be honest and open. You also need to bring the right materials to the interview. Bring any requested documents that the panel have asked you for and review your notes while you wait. It helps to calm you. Having everything ready as a show of respect for the process is really important first impression. This also might seem obvious, but you really do need to dress for success. Many times we've seen people that have come in too casual or even messy to an interview, and it shows disrespect and a lack of real enthusiasm for the role. So nothing too revealing or any inappropriate attire. You need to dress for the job that you want. Business casual or professional attire or a neat and tidy uniform is acceptable. Well-groomed and a polished appearance. It really does make a big difference. You also want to make sure that you're being engaging with the panel, but you don't want to seem too overly eager. You want to be sincere and enthusiastic. Don't overdo it. Don't swoon over the panel members. You want to balance out that enthusiasm with professionalism. Be prepared, be engaged, and be respectful. Body language does really matter as well. There are two things that can make or break an interview: the body language and how you answer the question. You need to sit with a confident posture, either sit or stand tall, depending on the circumstance. You need to maintain eye contact. This shows confidence and attentiveness. You need to watch your hands as well. Avoid fidgeting or doing nervous tapping or clicking of pens, any excessive gestures. It shows your nervousness and it shows a lack of confidence as well. You need to smile naturally so that you convey warmth and enthusiasm, but not that you look unnatural or overly eager. And a really useful tool is mirroring the interviewer. This body language tip actually builds trust and rapport in the person that is talking to you. Now, when it comes to answering questions, the key is really be concise. This point may seem counterintuitive to some. After all, the purpose of the interview is to sell yourself with words, right? But this is true only to a certain extent. Confident individuals tend to use 10 words to say what a nervous individual might say in 100, and often much more effectively. Excessive talking is a clear sign of nervousness and takes valuable time away from an interviewer accurately assessing the candidacy. Use the STAR method. So describing a situation, your task, the action you took, and the result is a really good tool in order to make sure that you are concise in your answers. So stay focused and answer exactly what's being asked of you. Clarity and confidence will always stand out in an interview process. You also need to practice the art of listening. Listening is just as important as speaking. You need to nod occasionally, maintain open body language, and really hear what the interviewer is saying. Your interest or lack of it will show on your face. Interview nerves are completely normal and often expected, but they don't have to derail your performance. Having some exercises that can help you to reduce your nerves will allow you to stay focused and remove some of the cognitive load that can be created by increasing anxiety and stress. A very simple exercise is to practice deep breathing. When you're anxious and our heart rate increases and we start to increase our rate of breathing. By taking long, slow breaths, our body is effectively tricked into slowing our heart rate and therefore reducing our stress levels. Increased oxygen will also allow us to think clearer. I don't know about you, but have you ever been standing in front of a room full of people to give a speech and all of a sudden your mind goes completely blank? This occurs because we're holding our breath and we're essentially starving our brains of oxygen. So by taking a long, slow breath and delivering an injection of oxygen to our brain, we'll suddenly regain our thoughts and can continue. And this is a really effective tool in the middle of an interview if you find that your mind's gone blank as well. Next, you need to actually think about how you can reduce your emotional attachment to the outcome. Remember, this is a two-way process. You're also assessing if the job is right for you. And that mindset can really help ease pressure. But if there are two people with exactly the same skills and same experience interviewing for the same job, one person is really emotional about the outcome or one is not as emotionally attached, actually, not that they don't care, who do you think will get the job? It'll be the person that doesn't have the emotional attachment because they're not letting their nerves or that outcome overwhelm them in the process. Visualization is a great tool for this. Picturing yourself walking into the interview, speaking confidently, and leaving with a sense of pride can often help with reducing the nerves and that emotional attachment to the outcome. But ultimately, nothing beats preparation. Practice your answers, ideally with someone else or in front of the mirror. The more familiar you are with what you want to say, the more confident you will feel. So as we wrap up here are some of the final tips to leave a lasting impression. First, arrive on time or even a few minutes early. Being punctual shows respect and professionalism. Be well prepared with your notes and any recommended documents and walk in confident and calm. Show genuine enthusiasm, but avoid coming across overly eager. Balance is key. You want to be interested, not desperate. Be sure to ask strong, relevant questions at the end that reflect your understanding of the role and the organization. And finally, end on a positive note. A firm handshake, eye contact, and a sincere thank you can go a long way in reinforcing a strong professional impression. So I hope you enjoyed today's content, and I hope it was valuable in preparing you for your next